Hi everyone. My identified problem is the need for parent education and community programs. Into my identified problem, um, the problem is the lack of resources and programs available in communities that teach about working as a unit and also identifying and preventing abuse. So there's certain problems that families and communities face that can lead to abuse, whether it be accidental or even cycles of abuse that have just gone on in the lack of knowledge in families. Some problems families face is again that cycles of abuse, lack of education, whether that's going on to college or education about development of children, low access to resources such as affordable housing, food assistance, and health services, and then also cultural differences, as in some abuse is defined in certain cultures and not in others. So the same thing might not be abuse depending on the culture. Some problems for communities are high poverty, lack of government assistance, lack of programs to help families, and then a lack of collaboration in the community as well as with other organizations, and then a lack of research. My solution offered is development of community programs that increase the knowledge of child abuse and neglect. So, teaching the community how to identify abuse and neglect and how they can act on that. And then the development of programs that teach new and to be parents skills beneficial to being an effective parent, as well as collaboration of the community with policymakers, advocates, and families to establish better protections to children that will help them in the long run prevent abuse and neglect. So, my first article was on unintentional child neglect. The summary of this article was that it is a review and observation of unintentional child neglect in families. Um, Factors of unintentional abuse were defined, such as those cultural differences that I talked about before, unapparent abuse to people where they don't realize that what they're doing is harmful to their children, family socioeconomic status, so not being able to provide certain resources such as education and health when necessary, and then also education level. Strengths of this study were that it was a literature review, so it went over all the other studies done on child abuse and neglect to that point and how programs can be effective in helping prevent that. But some weaknesses of this article were that of the study were that the measurements on what counted as neglect in the observation they did could be debated for accuracy on a wide scale. Um, and implications of this study are that child abuse and neglect can be hard to define due to certain factors, so it can be hard for people to be knowledgeable on that. And that also teaching parents and families can decrease unintentional maltreatment of children. And then this just is a little chart that goes into the different kinds of abuse, such as verbal, um, physical, emotional, and then also neglect, like educational and medical. Article 2 is about supporting positive parenting in community health centers. This study observed the outcomes of the American Psychology Association's act called Raising Safe Kids that trains parents positive parenting methods that decrease aggressive behavior and promote effective parenting skills. Strengths of the study were that it studies is that it evaluates an effective method of guiding parents and decreasing child maltreatment. So it gave important steps and ways in which families can decrease their parenting skills that may lead to cycles of abuse. Weaknesses were that it is not longitudinal, So it was not, you don't see in the future if those parenting methods, if changing those, if that led to a decrease of violent behavior in parenting in the future, and if it held up. It was only done in the health setting, one environment, so this study didn't look at how it was evaluated in other settings, and it did not look at individual community needs. Implications of the studies are that programs that address family needs for education can be used to decrease child maltreatment and potentially end cycles of abuse. And then this is a little chart about the risk factors that can lead to abuse, such as low education, low income, not understanding developmental needs for children, and then it goes into how you can prevent those through activities and programs. And then finally, Article 3 focuses more on the community aspect I was talking about and the programs. It was building a neighborhood network, which was a longitudinal study of 2.5 years that that showed the collaboration of different organizations in a single community. The strengths of this study are that it was longitudinal, so you got to see the longish terms of the effects of that. And then it also laid out several phases for creating a systematic neighborhood, fighting to end child abuse. So it gave a lot of stages to how you can implement these kinds of things in your own communities. And then it showed a lot of examples of different programs that were used to prevent child abuse and educate both the community and individual families. Weaknesses were that it was conducted in 1997, so it only had what was done up till then to go on. So it's a little out of date, but still relevant in my opinion. It only observed one neighborhood that, as I remember, was an immigrant neighborhood, so it's not exactly diverse in who it is applicable to. And then programs were primarily implemented by the study itself, so it didn't deal as much with programs that were already in the neighborhood. They actually had to make new programs. The implications are that high levels of maltreatment exist in areas with high poverty, low education, and poor housing. The collaboration of programs specific to community needs can prevent child abuse and neglect. So going in and finding what is necessary for that community and what their risk factors are can be useful in preventing abuse in that specific community. And then this is just a little chart I made about creating programs that address child maltreatment, such as studying the cause, creating a cooperative and nonviolent society, advocating for policies that work towards prevention, providing resources and individual care, and informing the community on identification and prevention of child abuse and neglect. All of this is, what all of this means is that there is definitely an issue of programs not being available to families, and this leading to accidental neglect. So there are certain risk factors identified that increase the chances of child abuse and neglect. Community resources and programs can be implemented that address individual risk factors, which is very important. And parent education programs teach effective parenting skills and can decrease abuse and neglect, which can end cycles of abuse and prevent accidental neglect and abuse. And then community engagement creates a safe environment that fosters strong relationships and works towards the prevention of abuse and neglect. So those community relationships and programs are important to preventing abuse and neglect. And that is it. These are my references. Thank you for listening. I hope you enjoyed.